Hi everyone, we're here at Conneaut Lake Vet and I'm here with Dr. Donnie Consla, and today we want to do a program on UTIs in dogs.
Yeah, we'll talk about the lower urinary tract and
Okay.
some more common conditions and diagnostics that we have, and just stuff that presents in that area.
Is it common?
Very common, yeah.
Is it more common in female dogs than male dogs?
UTIs or
Yes.
lower urinary stuff in
Well,
general?
UTI.
Yeah, we'll get to the UTI, but the lower urinary tract starts at the bladder,
Okay.
right? If we're talking the whole urinary system, you've got the kidneys, the ureters, which are the
Right.
little tubes that are attached to the bladder. The lower urinary tract is the urinary bladder and the urethra.
Okay, so
and
where
then
does
to the outside world?
when they have, yeah, right. So whenever they have difficulty, where is it from the kidney down to the bladder or towards the exit from the body? Where does this usually
Well,
occur?
it depends. So if we're talking about the lower urinary tract, then it's got to be the bladder or the urethra.
Okay.
But like if you just came to me and said, yeah, my dog is having some weird, urinary stuff, we tend to ask some questions like, is there like large volumes of urine or small amounts of urine more frequently? Large volumes of urine tends to be more upper urinary tract, like kidneys. Small
Okay.
amounts more frequently tends to be like lower urinary, but that's not a hard and fast rule. So you got to kind of distinguish where the problem is coming from, and then when you localize it to the lower urinary system, kind of go from there and see what you can figure out.
Let's pretend I bring a dog in.
Mm-hmm.
And I say, you know what, I think my dog might have something going on. Mine happens to be a female, which was kind of humorous because I've never had a female dog. So I'm in shell shock, like what do I do now? I'm used to the boys that are attempting to or successfully raising their leg up all the time, so it's a little bit different. But what were some of the, so I walk in, what are you going to ask me?
Yeah, so the first thing, the technician will come in and get a history. So,
Okay.
Basic stuff. When did it start? Like what's going on? Like what's your interpretation of what's happening? They might ask some more specific follow-up questions like, has the water consumption changed?
Okay.
Is there any color change to the urine? Does it still look like yellow or is it red or
Come on, let's
green?
be serious. I can only find that out of it in the winter, and I'm seeing it on the snow.
You can see, like, if there's
Really?
a red stream of urine
Oh
coming
yeah,
out.
well
yeah.
it's kind of hard. It's easy on a male. Come on, that's easier. But with a female, that's where my problem was when I came down. I didn't know the answer to
Well,
some
you got
of the
to get on the
questions.
ground and.
Oh, crawl on the ground myself. Okay, gotcha. Okay. Okay,
Is there any color changes to it? Odor. Sometimes, like if there's like a really bad infection, people will notice an odor. Those are a lot of the history questions. Diet plays a big role, especially when we're talking about cats. Like what are they eating? Would it be anything that's prone to give them crystals or anything like that? Have they ever had issues before? Like recurring urinary tract infections, or have they ever had bladder stones in the past?
One of the questions that I answered, or that they asked me whenever, I think it was Anna that came in, and she said, did I notice any spots anywhere on the bedding or on the carpet or something like that? Well,
Yeah.
I had, and so we discussed that, whether or not I had seen anything like that, because
Right.
I was unaware of that also.
Yeah, so are they having accidents around the house? That question she asked can kind of get to like, well, did you notice like a giant puddle on your bed, or was it just like a few spots? Also kind of gets at like incontinence. They might ask, do you notice like the urinary accident all the time? Like is she walking around totally with it and then just squats down and pees? Or do you tend to notice the urine like on her bed after she's been taking a nap, or when you get home and she's super excited, trying to think about incontinence and stuff like that.
What about having to go outside more often?
Yeah, so are they asking to go out more? What happens when they do go out? Do they pee a little, squat, pee a little, walk a little ways, squat, pee some more? Or do they just kind of like sit there and pee and pee and pee and pee?
Yeah, the other question that I had asked was whenever the dog, it was my collie, one of my collies, And my concern was that she seemed to be absolutely obsessed with cleaning herself.
Yeah, so excessive grooming
Yeah,
of
and
the genitalia.
again, here we have back to the female dog, and I noticed something that I had never seen before.
Yeah, yeah. So those are a lot of the history questions. Then the next part would be with the doctor, doing the physical exam. Most of the time you can feel the bladder when you're palpating the abdomen. And so you can get an idea, is it full, like something is blocked and things can't get out?
Okay.
Is it very small, like the dog or cat is just going and going and going? Sometimes you can feel stones in there. It might just feel like a bag of pebbles, or you might be able to feel just like a couple of large
common?
stones. Yeah, relatively.
Kidney stones in the dog.
Bladder stones.
Bladder stones. Oh, they're
yeah. So
not in the
again, kidneys are upper urinary,
Right.
and we see kidney stones or nephroliths, but they tend to be just incidental findings. Like if I'm doing ultrasounds, I'll find one or two in an older dog, but they rarely cause problems like they do in people.
Are the lower? I'm jumping. Probably you're going to stop me and tell me to slow down. But is it more common for them to have issues with the lower part of the urinary system or the upper part?
I'd say it's pretty equal.
Is it really?
Yeah.
Okay.
Yeah. So feeling the bladder, and then of course, aside from feeling the bladder, you can't really see it on exam. You can't see the urethra, but you can see where the urethra comes out. So looking at the vulva on the females and the prepubescent penis on the males. That can tell you a few things. It can tell you if they're obsessively licking back there. You can see irritation.
Right.
You're looking for discharge. Sometimes I've had people come in like, oh, I think my dog female has a UTI. You take a look back there and there's like pus coming out. Turns out they had their heat cycle, a few years ago. It's
absolutely.
an old intact female, and it's a pyometra, and that's why an infected uterus, and that's why it's urinating excessively and drinking a lot. So sometimes you get little surprises that way too. But looking back there, are there any masses or polyps or things like that you can see, basically around the exterior that would be triggering things? In the males, there's the penis, and then the prepuce is kind of the sheath that goes around it. They can get infection up in there, and they'll act like they have a UTI, urinating small amounts frequently, licking down there a lot. But you get your urine sample from the bladder, and it's crystal clear. But if you pull the sheath back, then there's just all this nasty stuff up in there.
Well, here's just a question. It doesn't have a lot to do with this, but males, in my opinion, because I've always had male dogs, you can take them outside and they can pee 15 times in a row. My female, the one female that I have, tends to pee and then that's it. She doesn't seem to have to go constantly.
Yeah.
So
you can still cue in on behavioral changes, like a male that's marking, they're going to walk, sniff, lift their leg, and go on. If they're uncomfortable and urinating small amounts frequently because of that, they're going to walk, pee a little bit, shuffle forward, pee a little bit more. You can kind of tell that they're not feeling top tier versus just like, oh, I have to pee on every single blade of grass in this park.
In the whole yard. Right. Huh. Okay, so I brought the dog in. You've done the initial examination.
Right.
Now what?
And so then then we start talking about what things could it possibly be, and how can we go about figuring that out. So let's talk about some of the more common things, which we've alluded to a lot already. Certainly a urinary tract infection. As I mentioned earlier, tend to be more common in females, and that's just a measurement thing. The urethra is shorter from the outside world to the bladder, so it's easier for bacteria to get that shorter distance than it is the long distance in the male. And that is, cross species that it's like that typically. So urinary tract infections, that can be usually with bacteria, and there's all sorts of different types of bacteria. We can see like rod-shaped bacteria, which tend to be kind of the more nasty, foul-smelling, really uncomfortable infections, or some round-shaped bacteria. I'll tend to see that a lot in overweight dogs, females that have an inverted vulva, so they were kind of bred poorly, and the vulva isn't popped out, and it's kind of tucked in the skin folds come around it. That's the same issue with obese dogs, the skin folds just kind of
Right.
come around it, or those breeds that you just tend to think have a lot of skin folds, pugs, bulldogs, those sorts of things. And so what's happening there, the reason why they get more of those round bacteria is that round bacteria is just on the skin normally. And so when those folds of skin are kind of in on themselves, that bacteria is just in those crevices, just throwing a little party and makes its way up.
So UTIs then are more common in female dogs, and also then in certain breeds.
Mm-hmm.
So the ones that, like you just said, pugs and things like that, because of
Yeah,
the anatomy down there and
right,
things like that.
Exactly. Other things that we can see would be bladder stones or uroliths, cystoliths particularly if they're in the bladder. But what is happening there is there's kind of two camps of what could cause it. One is nutritional. So whether it tends not to be so much the food that's being fed nowadays, because in the past there were a lot of issues like the foods weren't balanced, there was too much calcium, it was acidifying the urine, things like that. So a lot of that has been remedied, but you can still use food to help in these conditions. So
is that like a special food, like
right.
what, KD? Is it
CD,
okay.
or SD, those sorts of things. So it doesn't tend to be as much nutritional anymore, but oftentimes how the dog is processing the nutrients. So like Dalmatians are often have a genetic mutation for an enzyme that's up in the liver, and so they excrete this particular compound, and when it gets with other stuff that's in the urine, it can make these stones. We can see like other conditions, let's say dogs with Cushing's disease. We've talked about that before, where the adrenal glands are producing too much stress hormone. Those dogs will often excrete excess calcium. So then you get all this calcium coming into the bladder from the kidneys, and that, you know, under certain conditions can bind with the other stuff and make stones. So you have kind of those metabolic processing sorts of issues. And then another very common reason we see stones is due to a urinary tract infection or chronic urinary tract infections. So there's the two most common types of stone are calcium oxalate, which are made of calcium and oxalate, and struvite, which have ammonium, magnesium, and phosphorus in them. So the reason we see more of these struvite stones with urinary tract infections is some bacteria have an enzyme that can convert urea, which is what urine gets its name from, back to ammonia. Okay, so in the liver takes the ammonia from protein and makes it into urea, which can be excreted in the kidneys. So some bacteria have this enzyme, and it converts the urea back to ammonia. What was one of the things that I said the struvite stones are made up of? Ammonium, which is just ammonia with a little proton tacked onto it. And so we can see where dogs with UTIs, these bacteria are making this conversion, and it kind of just gives the one piece of the puzzle, and then if there's magnesium or phosphorus there, boop, it comes together into crystals and stones. On the same vein, you can see recurrent urinary tract infections from a stone being there. The stones are porous, you know, like a sponge, obviously much denser, but the bacteria can go in all the little tunnels and crevices of the stone. And so, you know, you come in, maybe you don't do any imaging of the bladder, which we'll talk about in a little bit, but you just get a urine sample, you know, you see the bacteria, the white blood cells, the red blood cells, you treat it with antibiotics, okay?
Okay, time. Urine sample.
We'll get there.
Okay,
Calm
because
down.
I have a question about that.
So you treat the UTI, and then it comes back like 2 weeks later.
Yeah.
You know, it's like,
even
why
if you've given them antibiotics,
why
and all
is that
stuff.
happening? So sometimes it'll be there's like a stone in there, and you treat the UTI for the bacteria that's kind of, you know, touching the bladder, but then they leach back out of the stone afterwards. So bladder stones, common. We can see bladder tumors. Some of those are more breed related, like Scottish Terriers get a lot of the transitional cell carcinomas. But that can be a reason for, you know, blood in the urine or pigment in the urine. It can be a reason for either recurring urinary tract infection because you have this abnormal tissue in there, or they'll often present like a urinary tract infection because you have this mass in there irritating things. It's uncomfortable, so they try to pee to make it feel better, but then it still doesn't really feel better, so they try and pee more, and so it can cause a lot of signs like that. You can see where the mass can actually block the path to the urethra and cause obstruction, so they're just not urinating at all. I should mention that stones can do that too. We see that a lot in male neutered fat cats. The urethra just isn't that big in cats, and they tend to get like these mucus plugs or stones that can get blocked. So if the stone is teeny tiny, it can make its way through and get stuck. But masses we see, I would say fairly commonly, not all the time.
In cats or in dogs?
Dogs.
In dogs.
Don't usually see too many in cats. But that is a good point for another condition that is common in cats, and that is called feline idiopathic cystitis. Feline means cat, idiopathic means we have no idea why it happens, and cystitis, cyst is bladder, itis is inflammation. So inflammation in the cat's bladder, and we have no idea why it happens. FIC is a nice abbreviation. There's other names for it, feline lower urinary tract disease. There's all sorts of stuff out there, but basically these cats will present like they have a UTI, right? They're painful, they're uncomfortable, they're urinating small amounts frequently. There might be blood in this urine. They might be.
Can you see any signs of that in the litter box?
Yeah, they might be going on like the bed or pillowcase, and there's like blood clots in it and stuff like that. What's weird is there's no infection involved. So if you get a urine sample, there'll be the red blood cells and the white blood cells that tell you that there's inflammation there, but it's completely sterile. And we don't know a lot about it, but we know that there's some weird interplay between the cat's kind of stress hormones, and the immune system of the bladder. And this isn't stressed like, the cat is, being chased by a dog all day or, stuff like that. It's little subtle things. So it'll be like, oh, like we put up the Christmas tree, a few days ago, and now our cat's peeing everywhere. Or I had some family over for a little get-together, or like a friend came over, stuff like that. And so the cat's not, like sitting there freaking out, but like, I guess internally they're like, oh my gosh, there's this green tree in the house. Like, surely I can't survive. I don't know what the cat's actually thinking. But, and so that gets a little trickier to treat. There's some diets and stuff for it, which we can talk about more later. But that's another thing that we see commonly. Masses of the penis, vagina, vulva, less common. I probably see more like vaginal masses in unspayed older females. They can get like some polyps in there that sometimes can turn into cancerous masses. I've had a few of those. Typically spaying them makes it so there's not that hormone influence and it won't come back. I've seen a few like penis masses, but it's certainly not common. So
now you've done the examination. We've looked at all the possibilities. How do we determine what it is?
Yeah,
we're gonna do that little urine catch.
Right. So typically, your initial diagnostics, definitely a urine sample, right? You want to know what different factors of the urine are. You want to know, obviously, like, are there cells there?
Sure.
Bacterial cells, white blood cells, red blood cells. Some types of tumors will exfoliate cells that are characteristic of that tumor, so sometimes you can catch a tumor that way. We're looking at the concentration of the urine. That's very important for the upper urinary tract, right? The kidneys. The kidneys do a lot of things, but one of the main things is they basically pull water out of the urine to conserve it for the body to use, right? You don't just want to be tossing out water. That's a very important molecule. And so a normal urine should be pretty concentrated, right? If the kidneys aren't doing so hot, or if there is something telling the kidneys to throw away water, like our Cushing's disease dog or the pyometra dog, things like that, the urine can be more dilute. Or sometimes it can be like under dilute, like the kidneys are tossing out extra water, which means the kidneys are still doing work. But it tells you a lot about that side of things. And then there's this little dipstick that we use. It's got little squares on it, and you put a drop of urine on each one, and that's going to tell you things like the pH of the urine, if there's any ketones in it, you know, like a diabetic that's like a sick diabetic. They're going through some metabolic stuff, and they'll start excreting those ketones. Is there bilirubin in the urine? All those extra sorts of things. So that all goes into the urine test. So, you know, it's a $40, $50 test or something, but you're really getting a lot of information, not just about the bladder and the kidneys, but about a lot of other metabolic stuff too.
How are we catching the urine?
So there's...
that's what we all want to know.
Yeah, there's...
You know, the vet says, we need a urine sample. Can you get us one? I go, what? How am I going to do that?
Right, so there's...
especially on a male dog too, so how do we get these things?
Yeah, there's, we'll say like 3 main ways to get it. One would be to catch it, so you go out with some sort of vessel and
well, what type of, what do you use? Like
you can
a cup,
yeah, like
ashtray?
a clean Tupperware container or a clean jar that you've washed with soap and water.
Well, I mean, let's talk about the female dogs. So you got to go behind her. She's probably pretty good. She's going to squat, and you're going to be able to get something there.
Yeah, the males are easier.
The males are easier.
Yeah,
I think the females easier.
No, they're just standing there. You can see the stream from the other side of the yard.
Yeah, but you got to catch it.
Yeah, but the female, the vulva's like right on the ground.
Oh, okay. So you can use a container, like you're messing with me here, like a Tupperware container or an ashtray or something like that.
The downsides of that are no matter how thoroughly you clean your container, there's still going to be bacteria on it. So that's important for me to know when I'm interpreting the test results. If there's like a small amount of bacteria there, if I had gotten it directly from the bladder, which we'll do here in a second, I'd be like, okay, that's real. But if it's just from somebody's, old cottage cheese container, I got to be like, all right, that's probably just a contaminant from the container.
So my first choice is for the owner to try and catch it.
Right. Which is fine, but again, you're introducing more variables.
So that's really not such a good idea?
It's not my preferred route, but it's also free. You know what I mean?
So, yeah, okay.
There's that. I can get more information with another option that we'll talk about in a second here.
Okay.
So yeah, we call it a free catch if you're just going out and get it. Sometimes we'll do that here too. We have like an old 1 liter or 2 liter pop bottle. And if you're looking at it long ways, kind of cut it on an angle so you can just kind of slide it underneath. Yeah. That works well. The second route you can use is with a urinary catheter. And so that's something we would do here. So you're inserting a urinary catheter up the urethra and into the bladder. That I would...
Time consuming?
More so than the other 2 methods.
Anesthetize the dog?
No, not usually.
Just
we put like an anesthetic in the lubricant, so it should not be painful. The downsides with that is it's still not sterile. The urethra is not sterile, right? Anything south of the bladder is not sterile.
Right.
The bladder itself should be sterile. Anything south of it is not. So it's still the same concern you have with the free catch, is that if there's a little bit of bacteria there, it's like, well, was that just from the urethra, or is that a UTI starting up or something?
Okay.
It's also more traumatic in the sense that you're guiding something through. Like I said, it's not painful. We use the traumatic in a sciencey way, but there's going to be some exfoliation of cells as you're going up through.
Sure.
So if you see all these epithelial cells there, you're like, okay, that's probably just from me catheterizing the dog, not some tumor that's exfoliating cells. So again, more variables. Situations where we tend to consider that first, if there's a urinary obstruction, okay? So the blocked cat, that one would get anesthetized if it's stable. A dog maybe that has a tumor and it's blocking the outflow. And the other method I'm going to mention you don't want to do if there's a tumor. And there is a procedure that we can do if we've confirmed that there's a tumor. It's called a traumatic catheterization. So you put the dog under anesthesia, you put a catheter in, and you basically go back and forth while drawing on a syringe with the idea, like if this is the tumor and my catheter's going across it, I'm hopefully sucking a bunch of cells off of that tumor, and then you can spin it down and send it to a pathologist to try and get a diagnosis before they go see the specialty surgeon or oncologist.
Are there specialty surgeons around here, like probably PVSEC?
Yeah,
places
Pittsburgh,
like that do
Metropolitan Vet Hospital in Akron, those sorts of places.
That's where your dog would go if it really had a severe issue with both the bladder or the kidney.
Yeah.
Okay.
Yeah. The last method is called a cystocentesis, and that is where you use the ultrasound and a needle attached to a syringe, and you guide the needle directly into the bladder. This method gives you the most bang for your buck. And why is that? Because you get to visualize everything. So you get to see the bladder, you get to see if there's a bunch of inflammatory gunk in there. You can see if the wall is thickened, you can measure the wall. You can see if there's stones in there, if there's sediment in there. You can just go ahead and peek at the kidneys while you're there to see if they're all small and shriveled.
All with the ultrasound?
With the ultrasound. And we'll do this on a patient here in a minute. The ultrasound component of it, I would say, is kind of the gold standard. People used to do it blind, where they would just feel the bladder and go in. And I'll show you on the ultrasound why that can be bad. One reason is if there's a tumor in there, you don't want to use this method, because studies have shown that some of these bladder tumors can be seeded to the abdomen by your needle. So you go in, get your urine sample, but on the outside of the needle, some cancer cells are getting on there, and then you have to pull back through,
and
it deposits them in the abdomen. So there's case studies out there where there's transitional cell carcinoma in the bladder, but it was seeded to the abdominal cavity and like the body wall from that technique. So you want to know before you go sticking your needle in there if there's a tumor in there, because you could make things worse potentially by doing that.
Well, now, when I brought my dog down and we were trying to do something with the bladder, you were trying to get urine straight from the bladder. Which one of those methods
was
that?
That's the cystocentesis.
Okay.
Yeah. The other advantage for using the ultrasound is there's some pretty vital structures underneath the bladder. So you've got like your bladder, colon, if it's a female, the uterus, and then there's some big blood vessels like the aorta. So if you go too far, or the bladder is really small and it's kind of tucked up into the pelvis, and you're just going in blind, you could potentially hit the aorta or something important, and they could, bleed out. And I've showed some of the text before on dogs that we're doing. I put the probe on there, and the bladder's small. And it's like, this is why you use the ultrasound, because if I were to go in, the typical area where you would do like a blind stick, you can just see like the blood vessel like right there, like in a thin old scrawny cat, there's not a lot separating things. And, I can see that the bladder's, tucked up, and I can reposition. So there's a lot of advantage to using the ultrasound technique, and we can go
we're going to try that now. We're going to do that now. Okay, let's do.
All right, so this is Max. He's our clinic cat. He hangs out. He's got a little spot in the cat ward. And he's an older fella now, so he really doesn't do much in the line of blood transfusions and stuff anymore. But we know that he has kidney disease, so every few months we check a urine sample and make sure that he's not getting an infection from that. So this is the ultrasound here. We've used this machine before. We did a whole episode on ultrasound, so you can check that out. So we're going to focus on looking at the bladder. So this technique is the cystocentesis that we just discussed. Okay. So I've prepped his abdomen, his caudal abdomen, with alcohol, and I put the probe on, and already I can see there's a little something going on here. Okay. So fluid on ultrasound shows up as black. So this black stuff should be urine. But can you appreciate how it kind of looks like a snow globe in there? And there's all this kind of white, fuzzy, gray stuff. Can you see that? So I know there's a little something going on in Max's bladder, so this is a little surprise for us.
Does that mean he has to go to the bathroom, or?
Well, he has to go to the bathroom because his bladder's full of urine, but all this debris shouldn't be there. It should be crystal clear black. So remember I was talking about other things that are in this area? This right below it is the colon. So if you go, you know, we're talking 2 centimeters here, 3 centimeters. There's the colon. And if I turn my probe a little bit and come down here, see that little blue flicker? That's blood vessels coming through. And,
he's a good patient.
And Max has a lot of meat, so his aorta is not right there like some of those scary ones I was telling you about. But in some scrawny old cats, you can.
He's not too scrawny.
No, he's well fed. He gets a lot of love. Okay. See how that? Let me jiggle this. See how it's swirling? That material's moving around in there. So we're going to get a sample of this. So I've got a needle attached to a syringe here. Okay. And I'm going to use the ultrasound to guide the needle into the bladder.
Will this hurt him?
No. So that's the other thing. You know, like those really chiseled male models where, where their abs come together? You know what I'm talking about?
I've seen those.
That is where the muscle fibers connect, and there's no nerves there, okay? So the only thing he's going to feel is like the prick of the skin, so it's no different than getting a blood sample or a vaccine. Because sometimes it scares people, like, you're sticking a needle where? But it should not hurt.
I was just concerned. I was just asking.
Oh,
Max.
yeah.
Max wanted to know.
So I'm going to use this little light here on the end. That's my guide. That correlates to this little spot on the ultrasound here. So I know like what direction I'm going. And then I'm going to guide this needle in at an angle. So if you watch the screen, you should be able to see my needle go right into the bladder. Ready?
Watch him jump real far.
See my needle there?
Yeah, I do.
You see that? That little white, bright spot? So I, with the ultrasound, can guide my needle exactly where I want it to be.
Down to where you saw that.
I know I'm not going too far. I know I'm not hitting a mass. And then watch, it'll come out. Bloop. See that?
And now you've got your sample.
And now I've got my sample.
Now that's going to be a sample of the urine, or did you get a sample of where you saw something funny going on the screen?
The funniness was kind of everywhere.
Okay.
Yeah, all throughout. But now we have this so we can run it and see what's going on there. Thank you, Max.
Hey, it is pretty.
Yeah. So that's a cystocentesis. You can see it didn't really faze him at all.
Let me see.
And it's very easy to do.
I think I like it.
All right, so here we have Max's urine sample. Now remember, we took this from the bladder, so it should be completely sterile. There should not be any bacteria in it ever, okay?
Right.
Yet, here we have some bacteria. So you can see, like here, it's clumps of these tiny little round dots, little chains of them. So those are all those round bacteria that are having a little party in there. In his case, it's secondary to his kidney failure because that urine's not concentrated and salty and acidic like it should be. We can also see some cells. So this here is a red blood cell, red blood cell, red blood cell, and then we have some white blood cells as well. Now this I would say is not a terrible urinary tract infection, but it's a good example of how we did that diagnostic, the cystocentesis, 2 minutes ago, and now we already have results, and we can see what's going on in that sample. I can also come back to the other portion that we were talking about. It tells us how we got it, cystocentesis. The color of it, straw, it should be more of like a golden yellow if it was concentrated, so that gives you an idea already. It was a clear sample, so we didn't pull it out and it wasn't super hazy and turbid, or, we could still see through it. The specific gravity, that's the concentration, okay? 1.008 to 1.012 is kind of that gray zone where you wonder about the kidneys. In a cat, though, cats really concentrate their urine, so if it's anywhere close to that, you get pretty suspicious. So 10-18 is not great for a cat. So, but we already know he has kidney issues, so that's not surprising. The pH is just slightly acidic, which is good. There's no protein, sugar, ketones, urobilinogen, bilirubin, and just a little bit of blood, which we confirm on the slide that we actually get to see.
Well, now,
all
if
the
this
cells
was my cat,
Mm-hmm.
that wasn't the clinic cat, and you brought this cat in like this, then what would you do if that was my cat?
So, I mean, even for him, we'll treat him with antibiotics.
Okay.
Yeah.
Poor Max. You
Yeah.
have to treat him. Let's get him treated immediately.
And this is a good example of why it's so important to do like the quarterly urine checks on the kidney failure patients. I know we're talking about lower urinary stuff, but you've got this low-grade infection there, and if that goes on chronically, you know, that could cause him to be uncomfortable or lead to further issues like that bacteria getting up to the kidneys or something like that.
The turnaround on this wasn't more than 10 minutes.
It
10,
was
15
2 minutes.
2 minutes until
Yeah.
we took it, they brought it out here,
I
got
mean,
the
yeah,
evaluation.
it took me, 30 seconds to get the sample, and it took the machine 2 minutes to run
Right.
it with the text interpretation, so.
Okay, thanks very much. I appreciate that opportunity to see that. Most people would never know what we were necessarily talking about, but now we took the ultrasound to the results, so that was a great step for everyone to be able to experience and check it out today. Okay, let's review very quickly why we did this.
That was, again, the procedure called a cystocentesis, where you use the ultrasound to guide the needle into the bladder to get a urine sample to run, but also to give you some extra information about the appearance and structure of the bladder.
So everything's diagnosed. We probably need to be thinking now. So we've come back with some ideas. What are some treatments that we can use? Can we jump to that?
Yeah, so treatments you tend to be more like medical and surgical.
Okay.
If you identify an infection, you're going to pick an appropriate antibiotic for that. You might consider a urine culture, especially if it's a recurrent UTI or something like that.
A urine culture. In other words, take a sample of the urine.
And send it to the lab, and they'll grow the bacteria and find out.
Oh, that doesn't happen here.
No.
You send it out.
Yeah.
Okay. All right.
The regular urine sample we do here.
Okay.
Yeah, so antibiotics, pain medicine, UTIs are uncomfortable. Any human that's had one doesn't feel great, so oftentimes we'll give them something for that. A course of antibiotics, you're usually talking 14 to 21 days for a bladder.
I think it was
thing.
14 what we did.
Yeah. Let's say it's incontinence, okay? There's a medicine that we can use for that kind of helps tighten up the sphincters. We usually check a blood pressure before we do that, because one of the side effects of that medicine can be increasing the blood pressure. So if they already have high blood pressure, you don't want to make that worse.
Does the urinary infection usually go away after the use of the antibiotic?
Yeah, typically. And I would say within 24 hours, most people notice a big difference in the comfort level of the pet.
But then it can come back.
Well, yeah, sure.
Is it common for them to come back?
It happens from time to time.
Okay.
There are some cranberry supplements that we can use if there's a certain type of bacteria there. It can help it so it doesn't stick to the urethra and make it travel its way up. That'd be used for recurrent urinary tract infection. If it's a cat with that weird inflammatory condition we talked about, we're typically doing pain meds. We'll often do a laser treatment on the bladder. We have an episode on the companion laser,
Okay.
but that's a way you can help get the inflammation down. We're often switching to a special food that has some tryptophan and stuff like that.
For the cat or for the dog, or for both?
For the cat.
For the
Yeah,
cat.
this is more of a cat condition. If you find a stone, usually you're talking about surgery to go in and get the stones out. We send the stones off to the University of Minnesota. They tell us what it's made of, and then we can pick a diet so that the stone doesn't come back again.
How big are they?
They can be as small as a pinhead up to like a golf ball.
Really?
Yeah.
Okay. Or an eraser or something like that. Okay.
I had a little Shih Tzu I did surgery on. She was a puppy and had one, but the stone took up her entire bladder.
How do they get one? Just because of what they're eating?
Yeah, those
or
different
whatever?
factors we talked about.
Sure.
The metabolism and nutrition, infection.
Huh.
There are some diets that sometimes can dissolve certain types of stones. It doesn't always work, but if we've got like a patient who's kind of like a more of an anesthetic risk, sometimes, and they're not in pain from the stone or something, sometimes we'll try that first. But usually you got to go in and take them out surgically.
Another question: Can a dog, going, of course, dog oriented as I am, can it, just because a dog gets an obsession with cleaning themselves, either the male or female, that if someone might think, oh, my dog has to have a urinary infection because they're cleaning themselves. How do we know that it's not a urinary and it's just their crazy cleanliness?
You got to do these tests to rule it out, and an exam to say that there's not like a skin infection or something back there.
Okay, because we don't want everybody running down and saying, oh, my female dog is licking herself,
right,
or the male is, and suddenly we better go. It's got to be a urinary or UTI. Okay.
And then tumors. Here we can do that traumatic catheterization, but typically at some point, if we want to take the more aggressive steps, we'd be referring to a specialty surgeon and oncologist to try and remove a portion of the bladder, depending on where it's at.
Wow.
And some sort of like chemotherapy follow-up. There is a type of non-steroidal anti-inflammatory called piroxicam, and certain types of bladder tumors will respond to that as like a means of chemotherapy, even though it's kind of just like a joint pain medicine. So I've had a few dogs where the owners didn't want to pursue that really aggressive option, but this was kind of a middle ground to try and see if it would shrink the tumor. And it did, and it bought the dog some more time until it recurred. But there's a lot of different options that way. It's not always just a death sentence.
Let's review very quickly. What are some of the signs that there might be a UTI or some type of a urinary issue?
Changes in urinary habits or appearance, so a change in the amount that's being urinated, the frequency of the urinations, the color, odor, consistency of the urination.
Drinking a lot of water?
Changing to drinking, drinking more. That certainly can make you think about kidneys and diabetes and stuff, but sometimes they'll just drink more if they have a UTI or like that pyometra situation that we talked about. Just being uncomfortable. I've had several emergencies where the dog just seems painful. They're kind of hunched up, they're shaking, yelp when they're picked up. It's typically little small dogs. But can't find anything that's painful. There's no masses, their back's not sore. So just for the sake of being thorough, you do a basic workup, blood work and a urine sample, and there's a UTI. 24 hours on their antibiotic, and they're back to zipping around.
So all the owners, of course, should have a piece of paper and pencil, and better keep track and remember some of these things.
Yeah.
You really should need to do that anyways as an owner. As soon as you see something, try and think back as to how many times you've seen something or what it is. So when I come to you, as I do, or to Dr. Wade or Dr. Becky, then I say, okay, fine, this is what I saw. This, and this, and I've got my whole list, which makes life a lot easier.
If you know what normal is, it's easy to identify when something's not normal.
Sure. Well, thanks very much, Dr. Consla. We appreciate it. It was a good discussion, and thank you for taking the time to show us the ultrasound again.
Sure.
And to do that on poor, was it Max? Is that the cat's name?
Max.
Thanks very much. See you again.
All right.